Experts say they're bracing for a big spike in patients at local hospitals in the coming week. As the coronavirus crisis continues, how are local hospitals preparing for this potential surge?
Joining us now live via Skype, Chief Medical Officer with Dignity Health Southern California, Dr. Nicholas Testa. Dr. Testa, first off, thanks for joining us. But we were just talking in the commercial break about why this week is so crucial, because this week has been one that local health officials have been targeting. So why this week?
So this week is so important because if you look at the modeling for when the spike of coronavirus cases are going to occur, it's really towards the end of April. Now, what you got to remember, though, is we don't really see the patient sick or test the patient till about 7 days after they've become infected. So if we're talking about a spike to the middle to end of April, it means those patients are getting infected right now. So that's why there's a real push this week, particularly to clamp down on our social distancing and really keep people at home.
Okay, Dr. Testa, we keep hearing about these rapid testing kits becoming more available. What kind of effect will that have on flattening the curve, and are they actually available?
Yeah, so there's the tests that we're talking about are the tests that allow us to get turnaround times in a day, opposed to having to wait for longer periods of time. And what we're seeing is more of the testing is occurring in hospitals. So hospitals initially had to rely on outside organizations to do the testing. Now that the hospitals can do it internally, we're seeing this much quicker turnaround. This benefits us really in two main ways. Firstly, at the hospital level, it saves our PPE. Remember, every patient who comes in who is a suspected coronavirus is going to get every provider coming at them with full protective equipment, masks, gloves, gowns, eye shields. That uses up a lot of PPE. Now, if it's taking us 7 days to determine if that person's positive or not, well, that's 7 days of PPE that we've used up. If I can tell you on the first day that you're there that you're coronavirus negative, well, then that's 7 days of PPE that I'm going to save. Now, from a public health standpoint, where it really helps us is if we're testing patients in the outpatient setting and I can more quickly tell you that you're positive, well, I'm going to tell you what, you're going to be a lot more likely to stay at home and truly isolate yourself if you truly know you have coronavirus.
Well, Dr. Testa, along those lines, when it comes to testing and getting results back faster, when we start seeing spikes in numbers, we had 59,000 pending cases last week. So when those results come back, we see a spike and the people already had it. What you're talking about allows us to get more of a real-time understanding of active COVID cases, correct?
100%. If we can confirm that the patient's COVID positive in hospital, we're going to manage them more, well, not more aggressively, but we just know that they're going to need the PPE. But at home, those patients are really going to self-isolate in a much more robust way. That's what my belief is.
All right.
Okay, Dr. Nicholas Testa, thanks again for talking with us this morning.
Okay, one local city